respected seniors and friends. The topic today is a very, very general topic. How to avoid medical litigation. Medical litigation is on the rise. Being a medical council member, I have seen 5 years back when we joined, and today the number of litigation or cases against the doctors has almost doubled. This is what we have seen through these 5 years. If this way it keeps on increasing, then hardly anybody will be there from our fraternity who will not have litigation against him. Litigation basically means when two people do not agree on something, they start arguing, and there comes a stage when this argument becomes a litigation by one or the other. In our profession, we face the similar things. Few days back, I read in newspaper, a person was killed for 300 rupees. Actually, he was not killed for 300 rupees. The moment argument started, then comes a break point. And that is the point where a person killed the other person. Same thing applies in our medical profession. Over many, many minor things, there can be a litigation, or there can be very, very major things on which there is litigation. Now, how to avoid litigation in medical profession? First, we see the causes for medical litigation. Undesirable outcome. It may not be unrealistic or always negative outcome. I come with a almost dead person to your hospital, but I wish and I feel that he will be revived, he will be all right. And the moment he dies or he doesn't recover to the level I wished, I start finding faults and do a litigation on yourself. Then there is monetary reasons. The cost of medical expenses has gone very high. It is like almost gold price. It is increasing day by day. If you do not have a medical claim policy or a medical claim policy of a reasonable amount, this cost starts troubling you. To avoid paying the cost, many people chose the way of litigation or fighting or do some abuse or something like that. Then ego in the society. घर वालों को दिखाना है, रिश्तेदारों को दिखाना है, मैंने डॉक्टर को सूद दिया. This is what we do litigation for. Then some people are litigant by nature. Lawyers, persons of my personality, perfectionist, जिनको आदत नहीं होती कि ना सुनने की, वो litigation करते करते. Then how to prevent medical litigation? टेटनस तो है नहीं भाई कि इंजेक्शन लगाया टीटी का और टेटनस नहीं होगी. लिटिगेशन को अवॉइड करना एक बड़ा सिंपल सा है. झगड़े को कैसे अवॉइड करना है? कोई तरीका ही नहीं है, कोई साइंटिफिक तरीका नहीं है जिससे झगड़ा अवॉइड कर सके. You have to learn all the ways you can learn your life and try every method to avoid litigation. Because once litigation starts, ना तो हमारे पास टाइम है, ना हमारे अंदर इतनी पेशेंस है, ना हम इतना झगड़ा कर सकते हैं. हमारा काम है रोजमर्रा, हमें वी हैव टू डू सम बिजनेस, एंड डूइंग इन दिस लिटिगेशंस वी विल ऑलवेज बी लूजर. इवन इफ वी विन द केस वी विल बी द लूजर. सो बेस्ट इज to learn as many ways as you can. The same method may not be right in next case. We have to learn. इस बार वो सक्सेसफुल हो गया, अगली बार वो सक्सेसफुल हो गया, जरूरी नहीं है. सो यस, इफ यू आर ए गैंगस्टर और यू कीप योर क्लिनिक्स नेम विश्नोई का क्लिनिक, नीरज भवानिया का अस्पताल, कोई आप पे केस नहीं करेगा, मगर फिर कोई आएगा भी नहीं. वी आर डूइंग बिजनेस, वी आर एंटरप्रेन्योर, सो वी कैन नॉट बिकम गैंगस्टर्स कि रोज आया जो आया मरीज को उसका थप्पड़ मारा, वो आप पे केस कहां करेगा, नहीं करेगा. बट देन वी कैन नॉट डू दैट. वी हैव टू रियलाइज व्हाट वी आर. वी आर simply doctors, very soft spoken, very gentle, always trying to choose the easy way. So we cannot become gangsters. Yes, अपने clinic का नाम हम रख नहीं सकते ना. Now then, avoiding litigation has no definite way, but there are certain things if we do in our practice, definitely it will help us in reducing number of litigations towards us. There are few common methods by which litigations can be avoided. You have to act daily, especially when you are dealing with your patients. मुझे आज भी याद है, नॉर्थ वेस्ट दिल्ली में एक डॉक्टर साहब के यहाँ डेथ हो जाती है. प्रेग्नेंट लेडी थी, पीपीएच हुआ, कुछ हुआ, बहुत पुरानी बात है, लगभग कोई 20-30 साल पहले की बात है. जब वो डेथ हो जाती है तो डॉक्टर साहब जब जनाजा जा रहा होता है, वह सबसे आगे पहुंचते हैं और कंधे को अर्थी देने लग जाते हैं, रोने लग जाते हैं. तो जब ये सब किया तो सारे जो रिश्तेदार थे उन्हीं को चुप करा रहे हैं डॉक्टर साहब को. तो इससे ये हुआ कि लिटिगेशन कैसे होगा, हो ही नहीं सकता ना भाई. डॉक्टर साहब जब उनके परिवार के आदमी हो गए तो अब ये तो हादसा ऐसा हो गया, अनफॉर्चुनेट है. तो इस तरीके से हमको एक्ट करना होता है. नॉट नेसेसरी दैट वी हैव टू गो देयर एवरी टाइम, बट सिमिलर थिंग्स वी हैव टू लर्न आवर ओन मेथड्स. समय बदल गया है, बहुत समय बदल. देयर वाज अ टाइम व्हेन इवन फॉर नॉन मेडिकल रीजंस डॉक्टर्स पे लिटिगेशन नहीं होता था. आप बाजार में जा रहे हैं, आपका झगड़ा हो गया किसी से, बातों बातों में उसने कहा डॉक्टर साहब है, अरे जाने दो डॉक्टर साहब है यार, इनसे क्या झगड़ा करना, इनकी काम करो और भेज दो. आज के समय में इफ यू आर डूइंग योर बेस्ट सर्विसेज, द अपोजिट पार्टी फील्स दैट आई हैव पेड फॉर दोज सर्विसेज. दिस फीलिंग, दिस चेंज ऑफ सिनेरियो हैज कॉज्ड अस मैक्सिमम हार्म, एंड partly, or I'll say a proportion of, a small portion of that, we are also responsible for this. Somewhere this fiduciary relationship with the patient, we have indented it. That relationship of trust has been breached, and at times we are also responsible in this. So we have to rebuild that trust. If we cannot do it as community, at least for myself I can do it. Now there are general methods which I am going to tell you. Good communication, and most important is listening. We do not listen to our patients, or if we listen, the moment he starts speaking, we start interfering. We do not give him 5 minutes so that he can tell his whole story. We feel we are the best man, we have maximum intelligence, and we know everything. Somewhere this feeling has gone into our heads, especially those who were in my era or my seniors, somewhere those who are in 60s, because we have been taught like that, and we still feel we are almost big bosses and we know everything. This tendency we have to decrease and reduce, because today if we listen to patient, we listen to attendants, I am sure more than 50% of your work has been done. This condition, to tell him, talk about his diagnosis, investigations. We have to explain everything to the patient. Possible cause, how much of the disease will be treated. We cannot treat everything, but we don't tell him that some portion of this will be definitely there even after your complete treatment, or chances of recurrence. दोबारा हो गया सर, गांठ तो दोबारा हो गई. अरे भाई, जब पहली बार हुई थी तब भी कोई कारण नहीं था, दोबारा भी हो सकती है. But we don't tell that to the patient. If we have a good communication and we tell everything to the patient, the chances of litigation decreases. More important is, we should always try to tell it in front of somebody who is related to that person. What advantage we have, once he is committed in front of his relative that this has been told to me, then he is less likely to do litigation again. Somewhere his internal conscience will hit him, or he will feel that he knows this has been told to me already. This way, the chance of litigation decreases. Then informed consent. We do not inform all the things. All the things cannot be informed, but at least major things we must tell them. Informed consent everybody knows. I am not saying nothing new. But at least we should tell them or not. In papers, we should complete our papers. Documentation is very important. Then about the prognosis, on each day on the round, you must tell him whether he is improving or he is deteriorating. What is the condition? These things help a lot. And even if they don't agree, we should mention in our case sheets. बहुत सारा गायनेकोलॉजिस्ट होती हैं जो सिजेरियन एडवाइस किया, उन्होंने एग्री नहीं किया, हमने भी कहा चलो कोई बात नहीं, नॉर्मल आगे बढ़ाते हैं, बट एटलीस्ट mark somewhere in your case sheet that advised cesarean, refused by patient or attendants. Even writing this will help you, but this is when we go into litigation. The talk today is about avoiding litigation. It may not help in avoiding, but it will help you in future. The next thing is, you must keep on telling again and again about the condition of the patient, admitted patient. Especially at the time of admission, he will agree to everything. But once you have admitted him, then he will not listen to anything. सर हमको अब नहीं पता, आपने तब तो कुछ भी नहीं बताया था, तब तो आपने कहा था सब ठीक हो जाएगा. But at the time of admission, you tell him anything, भाई मर भी सकता है, हाँ जी agreed. उस वक्त एग्री करता है. तो इसीलिए जब एडमिशन करते हैं उसी वक्त सारी चीजें बताइए. डॉक्यूमेंटेशन, फिजिकल फाइंडिंग, लैब रिपोर्ट्स, एवरीथिंग डेली लिखते रहें. ये डॉक्यूमेंटेशन बहुत ही इंपॉर्टेंट चीज है. जिस वक्त लिटिगेशन हो जाएगा तब ये काम करता है, पर जब आप डॉक्यूमेंट कर रहे होते हैं तो कहीं ना कहीं उसके दिमाग में जा रहा होता है. एंड स्पेशली इफ इट इज इन फ्रंट ऑफ हिज रिलेटिव, then it helps more than when it is done alone. Always try to involve his relatives. Then next is, at the time of discharge, we should write all the medication and instructions, what he has to do, what he has not to do, so that it is in black and white. Condition of the wound, how to take care of the wound. Instructions about discharge should be explicit. This is most important slide. If you see this and follow it, the rest 50% will be taken care of. Maximum number of litigations are because of this. Complications which has arisen, which was not anticipated at the time of admission. It is unfortunate, medical profession is such a profession where even we do not know how the patient will behave next minute. What will happen? Sudden problems will arise, or the expected recovery does not take place. Now, suppose a complication has occurred. Then what to do? We should tell the patient. If not 100% truth, but a covered truth. So we have to see that patient knows everything, and it should be amply recorded, and if possible signature should be taken. We have to maintain our dignity, not to speak any ill about our colleagues, stay within our limits of expertise. In the last slide I was saying, manage those complications. That is very important. If you cannot manage, refer early rather than refer late. Because the moment you refer him early, next bigger center will be able to treat him better than your expertise, and it will then final outcome, except for the finances, final outcome will be better. If you can treat at your center, fine, you treat him there. But the moment you realize it requires higher center, then refer him. Referring early is always better. This is most important thing, that we should treat all our patients with love, care. It will reduce your many conflicts. Know your limits. That is what I was saying, complication. Know your limits. If I can treat up to this level, I should not go beyond that. If I can treat up to this level, I should treat that only. We should know our limits. We should try to restrict within our limits. Your behavior should be very, very polite, smiling face, best dressed. When you are talking to patient whom with you have conflict and you are having some discussion, likely discussion, even the dress helps. Your dress should be good. These are general points I have spoken, but if some of these will be applied in your practice, it is going to definitely help. And thank you very much. My talk is over. But one more thing I like to say, that we as leaders has also failed, where we could have done much more so that people don't do litigations against us. Consumer Protection Act, we have done nothing. We should have done something so that it is not applied. Once it is not applied, people will not do litigations against us. There are many more things. Since the time is less, I will not be enumerating them. I wish that we as leaders and you as members should have come together and do something about these litigation. Thank you very much.